There's one thing that came into my mind that I just feel like, I don't know who's listening, but I feel like I need to say it.
If we're going to improve TMJ, I think not only are we going to look structurally, but we're going to look to improve nasal breathing. We're going to look to decrease your stress, maybe even do some cognitive behavioral therapy. But getting a proper nasal breath consistently, whether that's through breath work and at nighttime, that's only going to increase your outcomes, in my opinion, with TMJ pain.
If your jaw shifts off to the side, this works best if you look at yourself in a mirror, to where if you put resistance and try to have your jaw open and close as even as you possibly can, looking at the middle of the chin, against resistance, opening and closing.
Welcome back, everybody, to the Functional Code. We are excited to bring to you guys today another core episode. This is where we break down one of our recent podcasts into just the essentials. We're talking just the gems, the nuts, and the bolts. And so today we are going to be diving into jaw pain. This is something that we enjoy talking about. We see a lot of patients with this, and we feel we have definitely expanded how we look at the jaw, and I think we do a really great job of getting patients better just because we have a very out-of-the-box way of thinking about it, and we're going to talk all about that today. As always, I am Dr. Addy.
And I am Dr. Jace. Yeah, we're going to be looking top down from the nasal cavity to some of the top of the mouth structures to the bottom of the neck, all the way to the sides of the ears. So we're looking at every single thing here. Now, let's back it up a little bit. Let's look at the evolution on just the direction we're going in the first place. So when we first look at how the jaw started to evolve over time, we were chewing on hard meats. We were chewing on probably tough leather from animals and whatnot, just from how we scavenge food, let alone roots and certain plants. So overall, our jaw and our bone structure and our mouth were way wider in the first place. And now with the processed foods and now with some of the soft stuff that we eat, even as like infants, it's forcing our jaw to become more narrower, which is affecting jaw problems, it's affecting nasal problems, it's affecting so many other things, which is obviously causing us to be weaker and all these other problems. Doc, what are certain things that you've noticed with this evolution?
Yeah, it's funny. My practice of the jaw has been evolving over the years, and it's been just eye-opening to see some of the changes to us in history, I guess is the way to put it. When you take a look at, let's say, different cultures, maybe, if you look at like African tribes and how their teeth are usually really straight, they're white, and they have a very wide jaw, and it's because right away, I mean, they're eating dried meats when they're younger, and they're chewing, and they're actually strengthening the jaw. Versus in a society with more ultra-processed foods, and it's much softer, and we actually don't challenge the jaw. And they're actually showing that actually is causing malocclusion and changes in the way that our teeth are formed, and a lot more dental issues. But not only that, palate issues, sinus issues, just how the actual frontal face, mid-face is being formed. Now, what's interesting too is, I think the last 5 people that I've referred to my functional dentist has found something off, either about their sinus cavities, about their jaw changes, their palate. This is just 5 people in the last 2 months.
Wow.
Let alone, I'm sure, all the other patients that she sees on CT scan to show just how off a lot of these people's jaw structures, nasal structures are, and why it's just causing so many of these issues. These patients, whether it's TMJ pain they're coming to me for, or it's sinus issues, immune issues. One patient, she had sinus issues her whole life and found that she had very small sinuses when she was born, or whether that's how that was. And these things, you just don't know that they're there until you look and start to dive in, and that's why I think when we are looking at not only jaw pain but other things, you got to look outside the box. You got to look deep into the structures themselves. Clinically, it's helpful, but getting imaging is, I think, the next best step when we see a lot of these issues. But yeah, I think what we just have to understand is when we do have changes that we maybe have to accustom for, whether that's for me a deviated septum, we now have to think, okay, how can I improve that area? Or whether it's small sinuses, what kind of things we have to do there? Tongue ties now, they're so common in babies. Again, malocclusion. These are all things that can help breathing and that can help us function and eventually may contribute to pain.
Absolutely. And I know you said soft palate and even sinus pressure within. So we'll start diving into some of the anatomy just so you can see how certain areas and pieces get put together. So even if you have like a small sinus cavity, especially at an early age, or a deviated septum, that's going to affect the pressure within that sinus cavity, which is going to put pressure either upwards, outwards, downwards. More times than not, how you can influence it is going bottom up by pressing on the top roof of your mouth, almost back to like your molars along the teeth line and then a little bit inwards. And then you can add in pulsations, and you can feel what side has either, if is it lowered or is there more sensitive. So that's where you'd want pulsations on the area that's either sensitive or that is lowered for that pressure that's just been built up from there. And then back what Doc said, the nasal strips to open it up, to allow more oxygen, allow more air to come in to help for the whole process
100%,
itself.
100%.
So.
And over time too, with the certain and evolutionary changes, we see a lot of patterns, Doc, and I know that you do such a great job at breaking down what it is that we look for in a clinical exam. But what's just a quick, maybe 5 or 10 structures that you tend to look at once a patient who has TMJ comes into the office, and what is really the main structures that you find to be either an issue or having some type of guarding, pressure changes, all those kinds of things?
I appreciate that question. When I first look at jaw problems, I first ask, do they have a problem either when they close their mouth, does it get locked, or when they open, does the jaw get locked out of place? Because that's telling me specifically we're going to be probably looking at some sort of a disc, potential disc issue. So I'll show you a couple different areas. So with this disc, if you guys are looking at the screen, this is on the bottom side. So this right here is the disc, and it has ligaments on the back side, the outside, and the inside. So to help the jaw move efficiently and properly, they need to have stabilization around there. And if that disc gets stuck either forwards or stuck backwards, it's going to affect either locked jaw where they can't either close or they can't either open. I know there's a patient that we have, an individual that this has been for years on end. She can only open her mouth like 2 finger widths wide. So what we're looking at doing is opening up the jaw structure and how the condyles slide down as the jaw opens and closes. So we'll get into certain specifics with that, but that tells us a lot of the muscle guarding that's around there. Now, I'm more curious for everyone else on how we can address this yourself, more so than going and seeing a physician. So there's muscles on the top outside roof of the mouth, and then there's muscles behind the angle of the jaw. So between the medial pterygoid and the lateral pterygoid, it'll depend on is there shifting in the jaw when you open and close. For example, when we first look at a patient, we ask, do they have locked jaw, opening and closing? If not, awesome. Then you see how they slowly open their mouth all the way and then close. If there's deviation to one side and it stays deviated, there's a couple things that you want to pay attention to. It's either going to be some of the small muscles on the outside. So if it deviates to the right, for example, I want to look at the temporalis, or the muscle on the outer upper portion of the cranium right above the ear. And you also, because that'll help control some of the clenching, some of the closing of the jaw, you would also want to look at the medial pterygoid, and that is the one behind the angle of the jaw. So if it deviates off to the side, you can have yourself or patients or others put pressure behind the angle of the jaw and then add in some movement. So it's almost like a pin and stretch. It's very uncomfortable. Just be aware of that. And then we also want to check some of the muscles underneath the jaw, especially the digastric. So it's going to be the one right below the chin. And if that is contracted, that can also affect some of the deviation as well. So you'd want to see that. You'd want to see, is there popping, clicking? Now with popping, clicking, you'd want to go to the history. When you look at the history, do they have any motor vehicle accidents? Did they have Are they consistently sleeping on one side or their stomach? If so, that's going to force shifting of the jaw, and that'll affect how the discs move. That'll affect certain popping and snapping, especially if some small muscles around the jaw. So those would be a few ones that you'd want to pay attention to for the shifting as they open and close. Now let's say it's hard for them to completely open their mouth. Ideally, over time, you would want to release the muscle tension either on the top roof of the mouth, following to the top corner, putting pressure, and then slightly opening and closing the mouth. Something like, or behind the angle of the jaw, like I said, underneath the chin, or we can get into resistant work. Now this would be going back to some of the basics of what we know with physiology to address like eccentric work or slowly lengthening or slowly opening the jaw, vice versa, or slowly closing the jaw to where you have your hands hold pressure underneath the bottom row of your teeth as you're trying to close. But are you trying to close with the jaw that's deviated off to the right? You want to close a little bit with pressure, deviate the jaw to the left, and then try to close. So it's almost like we're lengthening or eccentrically lengthening some of the tissues on the whole right side of the jaw. So you can see how some of these processes that we've talked about, how you can address the tendons, ligaments, joints, muscles, can be applied to the jaw itself too. Those would be a few structures that you would want to pay attention to. You would need resistance. You would also want to look at a bunch of other factors, whether it's nutrition, diet, sleep, nasal strips, sleeping position. Stress is going to be a whole thing, and we're going to get into a couple other things on central sensitization in a sec too. But the last very key part that I want you guys to pay attention to is the hyoid bone. It's the bone underneath the chin. It's the only free-floating bone in the whole body. There's a lot of muscles that connect between the bottom part of the chin to the hyoid, and from the collarbones, chest, and neck to the hyoid. So if there's muscle guarding, if you're sitting at a computer for longer periods of time, that's going to cause contracture. It's going to cause a lot of muscle guarding, which is then going to pull and put more tension on the muscles underneath the chin. And then it can affect very easily shifting the jaw, and then you start having popping, clicking, you start having these tension headaches, you start having this soreness that you've never had before. All this stuff adds up. So you want to look bottom up, top down, and then the shoulders inwards. And we'll get into some other fun applications with that. But outside that, there's a lot of neurology that comes with some of this jaw stuff, and I think this works quite well into some of these next topics. What are certain things that you pay attention to outside the muscle structure for jaw irritation?
You know, what's crazy is the jaw has such direct innervations to the brain more than we think, and we actually can derive a lot of strength and function when we are clenching, believe it or not. Some studies have shown that we'll get like a 50 to 70% increase in performance or lifting strength by just clenching alone, and that's instantaneous. It's such a quick feedback to the brain to improve strength. So what that means is they had bodybuilders use these like hard foam type of applicators, and they had them clench down while they were doing lifts, and their performance improved like 50 to 7%. So what that showed was there was such a high amount of neurological innervation around the jaw, and it is a huge indicator of function in the body. And another problem that can be derived is a lot of pain that comes into the jaw can be from a more neurological, neuropathic kind of standpoint versus actually physically. Not to say they don't have pain from physical structures in the jaw, tightness, those kinds of things, but we can relax the tissue and that might improve the jaw. But if the underlying issue was actually stress-induced or some other issues, then we're not really hitting the root cause, which in TMJ pain, a lot of the times you need to start neurologically because you'll find that to be more of the root issue than just tight tissue. But one big thing that we talk a lot about is central sensitization. And for short, it just means that your brain is perceiving things differently than what's actually occurring in your body. A good way to think of it is for normal average humans who don't have anything wrong, when we push on their skin, there is a receptor that is picking that up and it's perceiving it as normal touch. Now, in patients who have central sensitization issues, when they have touch or are getting pushed on, they might actually feel that as pain, or it's called allodynia. And that's not, of course, that's not what's going on. But what they feel usually is either the threat is higher or there's more stimulation than what's actually occurring. So why this is important is we see these common conditions happen when we have central sensitization. These are called chronic overlapping pain conditions. And one of them are TMJ pain, along with IBS, migraines, reproductive pain. There's a bunch more, but it's heavily tied to a lot of these issues. So when we see TMJ pain, right away we're thinking, is this neurologically based? And if it is, what are the kinds of things that we need to do to improve it? So when it comes to central sensitization, the biggest thing is to be more focused on cognitive behavioral therapy, more pain science, pain neuroeducation, helping them understand that yes, there might be tight tissues and they're having pain, but in the base of it, we need to start getting your stress down, and we need you to start being more positive, and we need you to start maybe journaling and thinking about how this pain is affecting your life, but also ways to create a positive feedback and thinking about this pain as not fear-mongering and having catastrophization and rumination about the pain, because eventually those habits can start to really set you back, and you're going to start to feel like this will never get better, and eventually it's more of a chronic pain loop than it is something actually physical.
Yeah, and anytime I think about central sensitization, I go down those exact same pathways. I know you brought up cognitive behavioral therapy and just having patients kind of de-stressing, going through the pain science. I think that's incredibly important, to how not everything, if you perceive it outside, is always structural. It's that break of communication. I know previously when we did this jaw podcast a while back, we looked at the styloid process and the connection with some of the central sensitization, especially on how it regulates tension with like pretty much 3 muscles. So if you guys aren't watching, there's a small bone structure, like a weird hook right below the ear, but deep into the neck. Now that has connections between how you pretty much swallow, talk, chew, between the stylohyoid, which kind of runs at an angle down to the hyoid bone. There's one that goes to the pharynx. There's one that goes to the styloglossal for the tongue. So all this has a lot of neurological input in just a small little structure. So even to go into like deep meditative breathing, go into understanding the pain science, and even putting very light pressure below the ear and into the neck, and then almost getting either a hum or a longer exhale breathing with moving the jaw, that can release that tension from that small structure, which can also aid in the whole process thereof too.
Yeah, absolutely.
Tried that a couple times, and one with a patient and then a few sessions myself, and it actually works incredibly well. But outside that, Doc, I know you brought up in terms of clenching the jaw and using like the strength, or like the jaw exerciser, like where you bite down to try to strengthen the jaw muscles. I started using that in connection with, it's like a unilateral chest press type of exercise machine. I did it without it. I did it with it the 3rd set, and it increased the strength by 20 pounds.
Easily.
And I went more from rotating my head to the opposite way, to where it's almost like a single arm fly, but you're rotating your head and your arm together. So you're working some of the small muscles in the front and outside portion of the neck, whether it's you're looking up and away to your armpit as you're bringing your arm across your body, or straight rotation. Because that way you can get some of the smaller tissues on the front of the neck. You have to be cautious with certain patients, because if you have neck problems, that can throw off a few things.
For sure.
But yeah.
I would say too, if you already have an issue with clenching, maybe bruxism, then you just want to be cognizant of how much you're clenching until we maybe get the jaw pain under wraps too. Speaking of bruxism, that is something that we look for right away in patients who have jaw pain. And that is just another fancy name for nighttime clenching. And it can get so bad that it can even crack your teeth or cause other jaw issues. So that is the first thing that we look for, is making sure you have a good dentist, you have a night guard to protect this jaw of yours, especially if you are a clencher. And if you feel like you're under a lot of stress, and if you feel like your pain is right away when you wake up in the morning, those are usually the first signs. If you have a partner and they hear your grinding of your teeth, then that's probably a little bit easier diagnosis. But that's got to be something that you think about just in the long term, especially if we're going to be having this jaw issue take time to repair and get better. We just don't want your teeth to take the brunt of this while we're obviously going through treatment. And eventually at night, it's just good to have, just especially with patients for TMJ, especially if you've been having jaw pain, you throw in the night guard. A lot of the times the patients state that they don't have any pain in the morning and it's a lot better. So it can almost be used as like a brace. That's got to be one that we just got to keep an eye out for as well.
And even to touch on that too, and even if you guys aren't watching, there's a video playing behind me. You'll see that there's a disc that can be irritated. So if you have night guards in the mouth, it opens up and allows a little bit of a rocking to where the condyle of pretty much the bottom mandible, so the bottom part of the jaw joint, if we will, slid down, which will help ease up some of the pressure on the deep cavity of where the jaw lies in a relaxed state, if we will. So by having the night guard, it allows less pressure on where that condyle sits, and it helps put a little less pressure on the disc as well. I thought that was quite important to have a general understanding from there.
And the only other thing neurologically that I like to talk about is in regards to nasal breathing in itself.
Yes.
And so when I sleep, I use a nasal strip, which I've now been using now for, it's going on a year. And it's been by far one of the best ways to improve my sleep. And the science is heavily backed around being able to breathe out of our nose. It does so many different things. It improves parasympathetic activation, which allows us to have a more de-stressed state of being. But not only that, nasal breathing activates our vagal nerve system. And there's a lot of positive benefits to wanting to do that. And improving heart rate variability is one of them. And when we have a good heart rate variability, we can recover much quicker. We can improve our full system of our bodies because the vagal nerve regulates a lot of organs in our body. People that have poor vagal tone tend to be easily irritable. They can have heart palpitations if they're stressed. There are times where they're exercising and their body just shuts down. If you have true vagal nerve dysfunction, whether that's like post-COVID or from an accident. So the vagus nerve is a very important nerve, very important to focus on nasal breathing when we are sleeping and even just in general. But when we have that parasympathetic activation, it does heavily tie into the central sensitization, breath issue, jaw issue. And a lot of that times we see good outcomes with patients with TMJ pain. So if we're going to improve TMJ, I think not only are we going to look structurally, but we're going to look to improve nasal breathing. We're going to look to decrease your stress, maybe even do some cognitive behavioral therapy. But getting a proper nasal breath consistently, whether that's through breath work and at nighttime, that's only going to increase your outcomes, in my opinion, with TMJ pain.
Yeah, I absolutely love nasal strips. I'm surprised I don't have them on today. I'd rather prefer having nasal strips on than without.
I know, man. I'm wearing them all the time now.
It's like clarity and more oxygen to the brain, so I can think a little bit more quicker, have a little bit better memory recall to a certain extent. But yeah, strongly suggest even those people, like I was talking to Dr. Addy about this like about a week ago or so. One trip to the gym, I had 3 people ask me about it. I'm like, they asked, okay, I'm thinking about this. Does this work? I'm like, yeah, you need this yesterday.
Yeah.
I don't even have nose problems, and I see benefit from it. So obviously, if someone does, and then right after that, I went to the grocery store, and then another gentleman asked me the same thing. I'm like, okay, so that's 4 people within a 3-hour time stint, and just even that alone asks and states that like people are looking for something. there's question
They
marks.
just maybe don't know why.
Exactly.
But intuitively, they're like, hey, is this something that might help me?
Yes.
And I'm sure there is a reason for them asking. The two biggest things that I've found, number one, I've been tracking my sleep now with my new Whoop band.
Ooh.
And the first night I tried without a nasal strip, and then the second night I did try a nasal strip. It doubled my REM sleep. That alone was like, man, I not sleep with a nasal strip. So that was super exciting to see. Plus, every time I've been really sore from an exercise, the next day I wear my nose strip all day, I have so much less pain.
I've noticed that too.
It is so weird. And there are days where I'll be having a lot of pain or soreness, and I'll be like, nope, next day, put on the nasal strip, and my pain is reduced immensely. And I don't care even if it's just placebo, because that has been something that it's been done time and time again when I've been using my nasal strips. Those two things alone have been just huge for me, and I'm super glad that that intake has been created, because with typical nasal strips, they can carry a lot of adhesive on them. It can be tough on the nose, get a lot of clogged pores. But with intake, you're just putting 2 small strips on the side, and it's a magnetic strip that just allows for the nasal passage to open with just a simple click with the magnetic strip. So highly recommend intake. They definitely have created a lot less soreness and pain with consistent use of nasal strips that I've used, and super easy to use.
Yeah, I used a few others previously, and then it just didn't feel right. It irritated my skin, and I like how you can take the application out because of the magnet and add in like either a thinner one or a bigger one. If you wanted to sleep, you would want to go bigger versus exercising a little smaller. But yeah, It works incredibly well. My wife is still not the biggest fan of it, but she actually came around to it, and she said she had a decent night's sleep as well. It may be more of the appearance, but you have to look past that. I love these things.
I don't care anymore. I wear it all day. I don't care what people say. It works for me. It's great.
100%. I got asked so many times with patients, did you get in a fight? I'm like, no, I'm just trying
to
new
what happened to your nose?
Yeah.
I'm like, nothing, man.
You should try it.
So, Doc, now towards the more advanced, we'll call it steps, or even some extra gems before we close off here.
Beautiful.
Where do you find patients gain a lot of, we'll call it progress, or even improvement with these more advanced movements?
Yeah. So when you look at some of the physical ways that you can treat the jaw in terms of movement base outside of just like a pin and stretch, going back to some of the principles of lengthening or eccentrics, or even just isometrics, to where you contract or squeeze a muscle. If there's like an injury, whether it's a motor vehicle accident, or you just have chronic jaw pain or chronic tension where your jaw gets locked, open or closed, you would want to first start with ideally isometrics, and this is for any tissue that you want to start healing and recovering. So you want to get into the area, not into like pain, but maybe it's a little uncomfortable, whether it's shifting your jaw, like deviate to either side. And then try to put your hand on the outside of your jaw, and then put light pressure of your jaw into your hand, to where you're not moving your jaw, but you're trying to squeeze or contract the muscles nearby. You want to do that side to side, and ideally opening, holding your bottom hand underneath your jaw, and also closing, holding the bottom row of your teeth as you're trying to close. Now, your jaw is an incredibly strong muscle, so take that with a side of caution, to where you want to start the contractions lighter and then work into and build up from there. Probably about a good solid week or two. And then from there you can get into lengthening. So if you want to go deviation work, so jaw side to side, you'd want to put pressure of your hand on one side of the jaw, and without any contraction of the jaw. From there, as the jaw is completely off to the side, you want to put pressure of your jaw into your hand, and then have your jaw win in terms of that battle resistance, both side to side. That's going to work more of like the lateral pterygoid, and it's also going to work the medial pterygoid to a certain extent. You want to do this where your mouth is almost closed, and then you can work up to like where it's almost halfway between completely opened. If you get to where your jaw is almost completely opened and then go into deviation, that can have a higher potential to throw off the disc and lead to problems. So keeping it closer to where your mouth is closed, and then midway opening will help better for risk mitigation, if we will. The other one, in terms of if your jaw shifts off to the side, this works best if you look at yourself in a mirror, to where if you put resistance and try to have your jaw open and close as even as you possibly can, looking at the middle of the chin, against resistance, opening and closing, for both ways, quite frankly, that helps. And then even in front of the ears on the sides, you run across this top bone and then you go right below. So it's almost like off your cheek. That's a way that you can get to the lateral pterygoid. It's really hard to outside the top roof of your mouth. And then let's say another fun application, you have this pressure like you're flying in an airplane and you can't get that pressure to release. There's a small muscle on the top inside portion of the mouth called the tensor palatini velini. So you follow the top roof of your mouth and you put pressure almost hooking inwards right on the other side of your molar. And then you try to clench down and then after that, take your hand out and then try to yawn. That can work incredibly well to relieve that pressure. But outside of that, it's a little bit of it is resistance, a little bit is muscle work. And then I think for most people, it comes down to the stress. It comes down to the nasal breathing. It comes down to even opening up your chest and some of the muscles there. So when you look at that, laying on your back, either on your bed, having your arms hang off to your side, extend your head backwards, making sure there's no pinching pain at the base of the skull. And then from there, you can either have your jaw go either around the world, making a big circle, or not only when you're looking at yourself in a mirror, deviate your jaw to the side, drop it down, opening it, go to the other side, opening up, and then back to center. But also look at the jaw from the side view. Jut your chin and then retract it, but almost go in like a chewing formation to where you open up, you jut your chin forward, and you close it back to center. And that closing, that also will help almost move the disc into the right spot. So for some of this in terms of maintenance work, I'd suggest if you have no jaw problems, going through the round of world, maybe once a month, once every few weeks can help just to keep some of the tissues working just so they don't get stagnant. And then when you're on your back, also putting light pressure resistance into your hand in both directions so you can almost isometrically load when your chin and all the tissues of your neck are lengthened.
So getting the hyoid tissues and everything that attaches above and below too?
Yes.
For sure.
Yes.
Yes.
I feel like there's so many small things, but that is probably some of the main ways that you can clear up a lot of this jaw stuff.
Everything you have given as far as application-wise is a great starting point for a lot of people to try on their own.
Yes.
And just making sure, like Doc said, it's better to start with less intensity contractions and work your way into more intense. If you do have a lot of jaw pain, this might only be a 30-second application for you a day, just so that we don't overdo it. And then really think about nasal breathing, meditation, breath work, de-stress while on top of this. Or even maybe just starting with that, no jaw exercises, especially if it's been sore for you. Once we start seeing a change, then of course you can increase that, but you'd be surprised at what else this starts to help. I've had patients who their headaches go away, obviously their sleep improves, all these other things that can tie to the jaw. We're just excited to get you guys started and hopefully it helps you.
I love that, absolutely.
Yeah, anything else, Doc?
Actually, there's one thing that came into my mind that I just feel like, I don't know who's listening, but I feel like I need to say it. If you have got punched in the jaw before, or if you've got in a car accident where you've gotten hit from the side and you have whiplash, there's ligaments on the side, and if those, or the inside portion, if those get strained, there's a lot of question marks how to rehab those, especially for the discs. And that comes into the isometric contractions, whether it's you holding behind your angle of your jaw, and then you're trying to deviate into that pressure inwards, or holding your outside your jaw and you're trying to deviate your jaw outwards. Those will help bleed some of the energy into the ligaments to help the process to start the healing for that ligament, but there's not many other ways that you can go about it. There's different areas and different types of surgical routes that you can have with that, but that's just a small key that will start the process for you on that.
And you'd be surprised at how many people, MMA fighters, boxers, and then of course just individuals, like you said, have gotten into an accident. If you feel like you are having clicking, popping, jaw tracking issues, there could be a good chance that is a compromised part of the jaw. I would recommend first, of course, seeing a physician, but you can also try these things just at your own discretion, of course. But if not, go see someone who's specialized in this and make sure they are specialized in it, because you'd be surprised at how much is lost between your average and specialized provider in this area. So
yes,
we just want to make sure you're getting the help you deserve. As always, thank you guys so much for listening. We hope that this was valuable. Please share with anybody you feel like this could obviously improve their life. We just want to help everybody we absolutely can. Until next time, guys, you guys have yourself a great day.
Woo!
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.